perhaps actually while I've got the stand, I'll start. What I thought I'd do is just do a brief overview of the Central Cancer Network, because that might be an organisation that's quite new to a number of you. So I just wanted to give you a bit of an idea about how that sort of fits into a cancer control setting. The other thing I wanted to note too is that whilst the Central Cancer Network has pulled this Fono together today, we actually wanted it to be more reflective of wider health and Pacific communities in that wider setting. So there are other like stallholders here around heart and diabetes, etc. And when we go on and talk this afternoon about Pacific health planning and also potentially the Pacific network, that's the sort of thinking that we want, is that sort of we're looking really more about pan health rather than just cancer. Although, as I say, a lot of the program is geared particularly towards cancer. So if I just run through this briefly, it's just sort of a 10-minute presentation just about the network. All of these presentations will be up on the website, and with the ones that are being videoed, there'll be a link there through to YouTube where we've got a site that you can access them. So I just wanted to show you where the regional cancer networks that have been set up, where they sort of sit within the whole governance structure for cancer control. So if you're looking sort of from right to left, you start with obviously the Ministry of Health at the top, and then we've got Ministry of Health, the district health boards and the regional cancer networks working together, and then Cancer Control New Zealand and Palliative Care Council, which is sort of watchdog organisations that do a lot of strategic planning and also monitoring of the whole cancer program. Feeding into those groups, we've got the Cancer Control Steering Group, which is made up of those representative groups there, and they make a lot of the decision making around where priorities for activity as well as funding goes for the cancer control program. And then we've got different advisory groups that feed into that. So these are a lot of clinically based advisory groups that feed into that process. If you look along the top, you've got from left to right, you've got strategic direction, policy development, national implementation, and then local implementation. So you can see the roles that each of those groups have got across the whole cancer program, really. So Ministry of Health, more up into that strategic direction, policy development. DHBs and regional cancer networks more around the national and local, and now there's a bigger picture around regional implementation as well. Then we've got the Cancer Control Steering Group, which spans the lot, the advisory groups that span the lot, and then down the bottom is Cancer Control New Zealand, which is more in that strategic direction part of the program. As far as the regional cancer networks go, there's 4 of them, the Northern, Midland, Central and Southern cancer networks, and that's essentially the geographical areas that we cover. So they're based around geographical boundaries and pretty standard, except for in our region where we cover Tairāwhiti and Taranaki, and that is because of the traditional cancer pathways that have come into the Palmerston North to the Regional Cancer Treatment Service. So our catchment area covers 8 district health boards within that area. So this is essentially what the networks have been set up to do. So it's around leadership, facilitation and coordination, and to support planners and providers of cancer services. And it goes back to the goals of the New Zealand Cancer Control Strategy, which is around reducing the incidence and impact of cancer, reducing inequalities with respect to cancer, and improving the experience and outcomes for people with cancer. I've just put that up as a structured diagram. It gives an indication. All of the networks look slightly different, but we've got sort of the main core. So in the middle here, we've got a governance group, which is made up of, it's a multi-representative governance group across the region. So it's got regional representation, plus a lot of organisational representation on it as well as Māori, Pacific and consumer representation in there. We sit on the management team, so we've got some of the management team here. So myself as network manager, Shirley's one of the project manager, Steve, who was up here before, is another project manager around the inequalities program. Dr. Simon Allen, who we've got with us today, is one of our clinical directors. So we've got 2 clinical directors and 2 nurse directors that sit with us as well. We've also got, on the far side there, we also link into local cancer networks. So these are networks that are set up in each of the districts that do the local implementation and monitoring of what's going on around cancer control. So we work very closely with them. And then underneath there's a number of the different groups that we've got currently functioning, which align with the work program that we have going. And I'll talk a little bit about the work program. So we've got two main streams of work, which is one is our Addressing Inequalities program. So the key things that we've got on the go there at the moment is around national Māori leadership for cancer control. So that's progressing with a couple of hui next year, early next year, to formalise what that grouping will look like. Demystifying Cancer Workshops, which is a program about bringing the service providers into the communities, often in a marae type setting, and talking about cancer, the cancer journey, and also the services to support patients. We've put pilot funding out to the local cancer networks for them to identify and progress a particular project around addressing inequalities. And then we've had, in recent times, a fairly strong Pacific Communities program. So this work was started off by Karen Rangi, who's was in our team for part-time for a year, and she did a report on addressing inequalities for Pacific communities, and that's on our website, and you'll note the website address on the bottom there. Out of that, there's also been some work with the Hutt Wellington Cancer Advisory Group. They've done some Pacific translations, and Monica's going to be here today, and hopefully she'll get to talk about those when we talk about the different resources. We've got the Pacific Radio program, which is on the program to discuss today, and also Community Fono, which is on the program today, and obviously the Fono that we've got going right at the moment. Supportive care services also comes under that program of work because there's a lot of activity to happen around supportive care and a lot of particular work with communities around making sure they're linked into the services, etc. And community health development is around mainly around health promotion planning and how integrated that health promotion planning is. So it's very clear that there's a lot of health promotion that's not just cancer, doesn't have cancer just as the sole sort of beneficiary of it. You know, when you're thinking of tobacco cessation, for example, that cuts across all of our chronic diseases, really. So it's about, you know, how can they perhaps work better together. We've also got a tumour stream program, which is where we look at specific pathways for cancer patients. And so at the moment, lung, bowel, head and neck and gynecological cancers are the ones that we've been looking at. And these are about, with all of those 8 district health boards, it's about how equitable is that pathway from, let's say, someone that's diagnosed with lung cancer in Tairāwhiti versus someone that's diagnosed with lung cancer around the corner from Wellington Hospital, and looking to see at those journeys and making sure that we can get access to services more equitably. And also multidisciplinary meetings. So this is a meeting where clinicians come together and discuss actually the appropriate care plan for a patient. So there's a lot of work on developing those up. Just some general activities also, health service co-design workshops, and again that's on our program today if you're going to attend that one. It's about looking at a toolkit that you can use to work better with consumers around redesigning services. Because we have 2 cancer services or cancer centres in our region, we've got a program of work around getting some better alignment between those 2 cancer centres as well, and that's very strong in the regional services plan that we work towards with the district health boards to strengthen those services. We put out an indicators report. Our next one will be out in October 2012, but they're on our website. You'll see previous reports on our website. And that's about looking at the whole cancer continuum, right from sort of some prevention indicators, screening indicators, treatment indicators, palliative care indicators, and providing a snapshot of what they look like across our region, but also from a district perspective. So it sort of gives a bit of a table as to how different districts are achieving or working towards different targets and indicators. And there's also a lot of breakdown as far as ethnicity within those indicators. So it's that, along with the health needs assessment that we've done, is a good report from a cancer perspective if you're looking for data. Facilitating collaborative groups, so we've got a number of groups that are on the go. Cancer consumer representation, we've got a contract with the Ministry around leading that work. At the present time, we're not great in cancer about using consumers and bringing them along with us when we do all this decision making. So we've got a lot of programs of work happening around that. And we've just brought the 2 nurse directors on board, and so there's a cancer nursing strategy that's being developed over the next few years as well. So that's just roughly how the network sort of hangs together, really. What I think we'll do is, if there's sort of questions, if we can leave it to the end of the session, and then we'll go from there. So perhaps if I can invite Dr. Simon Allen up now, and we'll get Simon to do his presentation, which is about the overview of the cancer journey. So Dr. Allen is he's a medical oncologist from the Regional Cancer Treatment Service, but more recently is more involved with Arahanui Hospice as a palliative care specialist. And as I say, Simon's one of our clinical directors on the network as well. So welcome.
Thank you.